Hello, I'm Chris Howell, chairman of the Chris Howell Foundation, and on behalf of the Chris Howell Foundation, I want to say thank you to Esther Davis and her team for allowing us to be a part of today's taping. It was our pleasure to be able to open our facilities to the group today to be able to allow them to come in and tape, because that's part of our mission. Our mission is to educate and raise awareness regarding health, wellness, and financial literacy throughout the community and underserved communities specifically. So we're really pleased to be a part of today's event. So without further ado, here's your host for today, Mr. Robert Ashley.
All right, thanks a lot there, Chris Howell. We certainly appreciate that introduction. And once again, my name's Robert Ashley. I've served as news director, talk show host for radio station Heaven 97 KHVN for some time here. We'll just leave it like that. And once again, it's an honor to be here on Esther Davis's show as we talk health with a very, very distinguished gentleman by the name of Mr. Zachary Thompson. Zachary Thompson served the Dallas County citizens for many, many years, well over 30 years, as the leader of the Health and Human Services Department. And he's in retirement right now, so we're honored to have him here with us today to talk about the coronavirus and COVID-19. And first of all, Zachary, God bless you, my brother. How are you today, sir?
Everything's going good, enjoying retirement, but this whole virus has brought me out of retirement.
Well, I'll tell you what, we certainly need you at such a time as this, with all due respect to Dr. Philip Wong, no disregard, but I've covered you and worked with you down through the years. Well, first of all, Zachary, coronavirus, we've never had to deal with what we consider a microscopic or maybe some sort of a nano type of enemy here. What can you tell us about the coronavirus, because this is new to us?
Well, it's new but not new. We've still been dealing with viruses. We dealt with the cold virus, flu virus. Now we have a virus that supposedly jumped from a particular animal in China and basically moved into humans. Now that's still up for question. Some believe that this might have been manufactured in labs. The truth will come out. The real issue is how deadly this particular virus is. The fact that you don't have a vaccine to date, and you may not have a vaccine a year from now, 2 years from now, or ever. So I don't want to lead people to believe that there is a vaccine being developed. They're looking at a vaccine, but this is so challenging and so deadly to all Americans, but specifically to African Americans. This is different than Ebola. This was a short-term process with Ebola. We were able to go in to Mr. Duncan's apartment, and you got to remember, in Ebola, basically, we saw Mr. Duncan come over to America.
Yes.
He went to the hospital, turned away, then had an episode at the apartment, and then was rushed to the hospital and diagnosed with Ebola. The family in that particular house was quarantined. Yes. The nurses were not. So now we move to the COVID-19. We're running into the same situation where we're seeing a virus that's hitting us from those with diabetes, those with heart conditions, all of the issues that African Americans face, all Americans, but specifically it's hitting us hard. So what we know about the virus is one thing, and I heard one scientist that I believe when he made this comment, when they asked him about the virus, he said, we still don't know. We hear a lot of scientists saying a lot of different things,
yes,
but each week we're hearing different things about this particular virus. And one of the things we heard in the beginning was this was similar to the flu,
right,
and that it would go away.
Right.
Wasn't that the scientist saying that?
Dr. Anthony Fauci of the World Health Organization.
Okay. So basically, in December, when they supposedly found the cases in China,
yes,
people were already wearing masks. People were already being killed. People were being separated with trying to tell the truth. In the United States, now I wasn't in the meeting, but they were meeting in January talking about what was going on in China. What could they have been discussing? Number one, they talked about N95 mask shortage. Well, we know that there has been a shortage because there was a shortage in 2014 with Ebola. The two nurses complained that they did not have adequate equipment when they were in Mr. Duncan's hospital room. So how is that new? They talked about the stockpile. We've been talking about strategic national stockpile since 1999.
Good grief.
So why don't we have enough ventilators? Why didn't we have enough items to deal with a coronavirus? Here's an example. If you listen to the scientists, and again, I commend our frontline heroes, doctors, and nurses.
Yes, sir.
But everybody is missing what they're saying. We're trying to prevent an overrun on our hospitals. But nobody ever talks about what's going on in the community. the hospitals. We don't want a lot of people like what happened in New York. Well, don't try to compare yourself to New York. Compare yourself to the fact that every citizen in North Texas should get a free COVID-19 test who are asymptomatic, period. There should not be a criteria because we have individuals who are walking around who are super spreaders, meaning that they have the virus and don't know it. So we're testing people with fever who have certain symptoms. Well, by the time you get a fever, you definitely know you're sick. So that's delayed. Some people are showing up and saying, I had no symptoms until later on. And so the point is, when over 50% of the individuals in Dallas County, in Fort Worth, in Denton, they basically are not, they're asymptomatic, no symptoms. So that's why I don't understand why we have a criteria on testing. Here's another example. Real quickly, I want to make sure that we're finding a number of people who are dying in their homes because they never make it to the hospital. Are those individuals being counted? So if this is a conspiracy, I will say this, then as African Americans, we need to wear our masks. We need to make sure that we're taking care of ourselves, eating properly, because this virus is hitting two groups, African American and Hispanics. But as an African American, I'm seeing the devastation that it's doing nationally and locally. That's why I've come out of retirement, because someone should have said from day one, we're going to be in this process for a long time. So 2 to 3 years. Right now, we're in June. You might as well say it's June 2020. We've been talking about this since January. Still no resolution in terms of a vaccine. Now our kids are going to go back to school, or they're planning on opening schools back up. That's going to be a challenge. So when you asked about the virus itself, we're basically talking about a virus that's going to impact us, and there's no cure, and the whole repetition of this particular virus is deadly to all of us.
My goodness. Well, once again, we are talking here with Mr. Zachary Thompson, who headed up the Dallas County's health department for quite some time, many, many years, well over 30 years in retirement now, and we're talking about the coronavirus and COVID-19. And Zachary, as we continue to talk about this topic here, when it comes down to what they call herd immunity, should we be trying to tweak our immune systems while we wait for a vaccine, or what can we do in the meantime?
That's an excellent point. That's what's going to happen, herd immunity, automatically. If we live, the fact that all of us, some of us may have already have gotten the virus. And so therefore we're building up the herd immunity. So here's what we happen. You remember when those people used to line up around our building when it was back to school immunization?
Yes.
That's because they were not getting immunized.
Yes.
Herd immunity says that if you have a number of people who are immunized versus those who are non-immunized, you don't have an epidemic or a pandemic. And so right now, you have a situation where you're hoping that all of us, based on the herd immunity, get the virus so we can build up the resistance. But the issue is those with medical conditions don't have the immunity to fight it off, and that's where it goes back to African Americans in terms of our health risk. Now, I feel sorry for a guy who came out and said, he tried to blame it on us as African Americans because we drink or we smoke. I don't even know why that discussion came up. Like we're the only race of people that drink and overly eat. You see how many people want to go out to a restaurant and it wasn't us. So the point I want to make is that when you start talking about eating right, I agree with that. Stop smoking, stop drinking, taking care of your body. You have to have that to build up that immunity to protect yourself through various viruses that may enter the United States. So if you remember Ebola, if you remember H1N1, I was directed with H1N1. And so luckily they developed a vaccine. But I'm gonna say this about the scientists, and I love them to death. But I bet you if we were in that meeting, you would think you was at the Baptist convention. They're praying hard that this thing blows away, because there's not. I'm not gonna say it's never gonna be a vaccine. It's just gonna be a while.
My goodness. So developing and tweaking our immune system. In the meantime, that's one of the best ways to stay safe possibly to tweak our immune system?
I think first of all, if we're on medication, take your medication, check with your doctor, eating healthy, making sure that you don't engage in congregate settings because you're already open because your immune system is compromised. And so therefore, and this is why everybody thinks it's man-made, because when it enters your system, it mimics whatever deficiencies you have.
Wow.
It goes into the kidneys, we hear that it goes into the heart, it goes into the lungs. So that's why everyone is thinking, and so I'm not going to be a conspiracy theorist. I'm just going to say it's amazing that you can have a particular virus that can impact you so quickly and kill you, and that has to be something, because if you look at in China, they don't know how many people died because they hid how many people had died from the coronavirus. But if you look at your Lysol can, if you can find some in your community, it has corona on there. So this is not new. So the virus itself has been around. But the herd immunity, eating right, we got to protect ourselves, and we definitely don't need to get around a lot of people. And I find it amazing they're opening up the churches. That's a discussion. They're saying that they don't want the choirs to sing. And so I'm going to say everyone needs to sanitize their churches if they're opening up. And some people may need to pay someone to clean the churches before and after. Not Brother Joe or Brother Zach. They need to get a professional cleaner to protect, and they need to practice that space. This is airborne. If you remember, they were saying, well, you can get it from touching this and doing that. And then they said, don't wear a mask. Now they're saying, wear a mask.
Yes.
So if the American people are not confused by this, they are exhausted based on the misinformation, no information. But from day one, when they locked us down, they should have said, this is going to be for the long term, because we have no answers. We have deaths, but we have no answers. We have cases, and the cases would be higher if we test everyone. So these testing numbers, I tell anybody, go to the State Health Department website. Look at how many people have been tested in the state of Texas. In Dallas County, you got 2.4 million people. In Harris County, you almost got 4 million people. Okay, you look at how many people have been tested. Those numbers are nothing. Everyone should get a free test without barriers, without criteria today. And if we don't do that, we're setting ourselves up for the second wave.
Should there be mandatory testing, and once we do develop a vaccine, should there be mandatory inoculations?
Well,
is that legal? Is that constitutional?
Well, let me say this. Based on the episode we just went through, it's going to be hard to convince people to be vaccinated. The reason why is because we got so much misinformation. When we do, and I'll be frank, and I hope nobody has a problem, I hope nobody takes offense. When we open up for the flu vaccine, we have white people standing in line to take the flu vaccine. I have to go to the black community to provide it. So now when you start talking about the COVID-19, if there's a virus, to convince a minority population, specifically African Americans, knowing that there's a lot of misinformation, they're going to have a great challenge. That's why I'm skeptical of when a vaccine will be developed. Again, that's why they're hoping, that's why you heard a person that I won't name say it would go away, because that's what everybody is hoping, that it would go away. But I think if a vaccine becomes available, those who are at high risk definitely, it's just like the flu vaccine. We talk about high risk population should get the flu vaccine. But I want to point out it's going to be a hard sell to African Americans knowing what happened the first time around. They never told us anything in the beginning. They didn't talk about high risk categories. That was discussed. They knew over in China that those with high risk were going to be challenged. But all they was worried about, Robert, was the hospitals. And that's why I think Chris, I think Dr. Davis, Fred, because this information, and you who do your show daily, is getting the message out. But when they came up that day and said, we're going to lock everybody down, everybody ran out and got toilet paper and paper towels, and that was ridiculous. This was discussed in January. When they locked us down in March, so what were they talking about?
Well, I'll tell you what now, as we look at this now, a vaccine, isn't the vaccine just a less virulent pathogen of the very disease that you're trying not to get?
Well, supposedly they are giving you a vaccine that is not a live vaccine.
Okay.
So that's the difference. And that's what we ran into with the flu vaccine. And that's the scary part, is that this is not a live vaccine. But you got to remember, every year, if you look at when we were doing the flu vaccine, they came back and said, oh, well, you know, the flu vaccine is only 40% effective. The next time it's 60%.
Yes.
They never said it's 100%.
Different strain, huh?
A different strain. They gave an excuse. So what makes me think they're going to have an exact strain developed for COVID-19? It's going to be next to impossible because of how the variation of this strain has impacted. So when you look at it, it won't be a live virus, hopefully. You know, they started out with the nasal spray with the children. They wanted everybody to get the flu vaccine through the nasal. Then they backed out,
Right.
because that was a live virus. So I want to point out, the shot was not, but the nasal spray was, and they pulled back. And so the scary part of this is the fact that you have no vaccine, and they keep telling people, well, we'll have one by the end of the year. Then you have another scientist come out, well, that's impossible. So I think the key on the vaccine is that I would not look for it. I would just protect myself with the face covering, with eating right, staying at home, and not being around a lot of people. I think that's going to be our best option. You know, we're in this is 2020. We're in the most, supposed to be the richest country in the world. We're supposed to have all the technology, and even China has not developed a vaccine. What makes me think that we can develop one here? Matter of fact, some of the items we needed, such as N95, swabs, we had to order that from China.
Yes, sir.
So
Yes, sir.
I guess at the end of the day, I wouldn't hold my breath in terms of waiting for a vaccine.
Would you take it if there was one?
I would be
You can
challenged.
plead-
No, I'll be challenged. No,
you
no,
can plead
no.
the fifth on that.
No, I would be challenged to know that if it was a vaccine that has been vetted
Yes, sir.
and that we've seen the shot really work, then I would consider it. But you can't rush a vaccine. So let's be specific. If they roll out a vaccine January 2021, I'll wait till after the first 200,000.
Yes, sir. All right. Now, another quick question, Zach, about this coronavirus. A little bit earlier, I asked you about a Chimera type virus, which is, you know, according to the books, it's a man-made virus.
Right.
Is it natural for a virus to be able to jump from an animal to a human, or a human to an animal? Is that a natural occurrence? Or
It happens. It happens. But here's the difference. Here's the difference that we don't know. It can jump from an animal to a human, but I don't know what's going on in the labs as they're developing this aspect. That's where the conspiracy comes in. There are viruses that jump from the animal to a human, but they also, as we looked at this particular lab in China, they were also testing this particular virus.
Yes.
And that's where it might have become more deadly based on, and again, this is a conspiracy, not what I know, it's what we have been reading,
Yes.
is that through those experiments, did they develop a deadly virus? That's why we're not been able to bring this under control. You had the world's greatest scientists that was seeing what was going on in December. They saw that in China. And then for them to say in January, now again, I got to go back to that. This is just like the flu. World-renowned scientists. So now you tell me, doesn't it appear it has to be somewhat man-made? Because they're looking at the same data, and then they change after they see how it impacted population. So that makes you wonder. And so what scientists always say is, you know, trust the scientists. Well, I always use the example. I trust everyone. Mechanic,
Yes.
but I'm still, when you change my tire, I'm still gonna check the lug nuts.
Yes, sir.
I'm gonna, if I go to the doctor, I'm gonna ask for a second opinion. So how come we can't ask the question to the scientists in this manner? And China is not even talking, so that's even amazing. So we don't know. So it jumped from an animal to a human. So what was going on in that lab? And let me say this on the biological agents. And as you know from Cold War, one of the things that Hitler was focused on was biological agents.
Yes, sir.
And so I'm not saying that I know for sure that this was something created by someone. But the way it's damaging our society and the impact that it's having on African Americans, it makes you lean that way.
Yes.
That this was something created.
My goodness, because a lot of the research that we've done, and those of you watching, you can Google, you just put virus, University of North Carolina, Chapel Hill, 2015. We understand that they had a bioweapons research laboratory
Right.
where they were actually conducting these type of tests, and they were using what they call this horseshoe bat that comes out of China. And the horseshoe bat supposedly has something in its composition that cuts off your respiratory, and we supposedly made a hybrid. I don't know if you heard about that. We made a hybrid of this particular bat in 2015, University of North Carolina, Chapel Hill. And when some of our scientists got caught doing it, a couple of Harvard professors got convicted, and then all of a sudden it gets outsourced to Hunan, China. So,
Well, but in 1999, when we were looking at biological agents,
yes, sir.
we are set up, and I can't talk about where these locations
Yes, sir.
were,
Yes, sir.
but they talked about mass vaccination.
Yes, sir.
And the key was, in case a biological episode or a virus outbreak, that we would move people to a certain location and provide the vaccine to them. And so my point is, a lot of this has been going on in terms of, as I pointed out, Hitler was famous for developing, and they talked about dirty bombs, they talked about a lot of things that could be released on the United States in the population that a lot of people going to sleep at night are not aware of. So I'm not one of those individuals that's going to say that I don't believe that someone developed this. I'm going to say anything is possible.
All right, well, Zach, I'll tell you what, we have maybe a few more minutes, and now, you know, all of this is happening during a presidential election year. Any concerns about this being political, or who has the power to do something like this? Who could gain from something like this? Or is it even conceivable to think that somebody has the power to do this and possibly gain? Because the U.S. economy, we were roaring. We had the lowest unemployment 50 years under President Trump. It seemed that way.
Right.
Because some say that when you go to North Richland Hills and when you go to South Dallas, the whole unemployment picture looks totally different.
Correct.
But do you think politics have anything to do with this?
Well, let me say this. Democrat, Republican, the donkey and the elephant. The only individuals that are getting run over is the poor people.
My.
The key is that those individuals who are in Congress or are elected officials, they always use this terminology. Never let a disaster
Go to waste.
go to waste.
Oh my God.
Because they're looking for running for office. That's the scary part. So that's why you have to turn off the TV. Because all that talking,
Yes.
look where we are now. First, everybody was running up to the TV saying, oh, we got a virus. And they were giving you models. We're seeing more models based on 1918. So I want to be specific to your question.
Ooh.
So the politics, each side is winning. And I gave this one example. The playbook was on, I have to be frank, on the Democratic side, they were talking about the overrun of the hospitals. Republicans stood back and said, okay, I'll tell you what, let's open up, because guess what? There's no overrun on the hospitals. So when you look at it, everyone has the playbook on each side. The ones that are losing, and unfortunately, and my prayers go out, is the families who are impacted by COVID-19.
My goodness. And speaking of families, what happened regarding the nursing homes? Because we, in New York and even here in the state of Texas, across the country, they were taking COVID positive people out of hospitals and bringing them back to nursing homes where you had people who were COVID negative. And then they shut off the families from seeing their loved ones, and it seemed like it just exploded in the nursing homes.
We all had a pandemic planning manual. So I guess nobody read it. But nursing homes, homeless shelters,
Prisons.
prisons, they were all high risk. Everybody was doing press conferences, but nobody was testing. That's where the politics came in. They were posturing, but they weren't positioning themselves to go into those areas and do the testing. So everybody, well, that's the state, or that's the county, or that's the city. No, the issue was test everyone high risk. That's why I'm going back to my point. Everyone in DFW who wants a test, not what the president is saying, everyone who wants to test should be able to get a test and no criteria. That's where we're losing the battle. Every time we talk about a criteria, I'm not impressed with a drive-through testing. Most of the people I know, we got a vehicle desert, just like we got a food desert. They need to have a walk-up clinic. They need to have a clinic, and I see some clinics go out to homes. But the issue on that is, I got to have a criteria. As you know, with African Americans, we got to, the people that's making the decision. I find it, and that's the only reason why I'm even talking now. Thanks to Dr. Davis. When I see that no one looks like us, that lets me know no one was in the meeting. Because what I'm seeing in terms of the discussions and the action planning doesn't reflect what our community needs, and that's the concern. Where's the CARE Act money going? No one even asked. How, they come with every time I look at TV, I turn on first thing in the morning, they're giving out $1 trillion. How many African Americans have gotten any of the CARE Act money? Is it all going so everybody can be off? Because that's what they're doing, paying salaries. This should go to black media. It should go to black radio. It should go to black social media. That you're talking about trillions of money. So if you ask me about politics, here's the issue. They use our numbers to get the CARE Act money, and yet they don't give any funding to our nonprofits, to our media to get the message out.
Yes, indeed.
When they hear Robert Ashley, they know you vested in the community. They hear Dr. Davis, Dr. Jones, Chris Howell. They see us every day. They don't know these people that's coming out. That's why nobody's listening. And that's why people get up one day and tear up a piece of paper and tell you they're going to open up. If they said that in South Dallas, they would have been in jail and still in jail.
You know it, that's a double standard.
That's it.
Well, Zach, as we get ready to wrap up, and I think we're going to have Dr. Karen Holly and others come in and talk a little more about psychological. Where do we go from here? I mean, we're getting ready for the fall, we're going through the summer, and then we got our kids, high school, and life has to go on. The country's slowly opening back up. If you were the Dallas County Health Director, and we keep hearing this talk about flattening the curve, where do we go from here? What do we do?
Well, we got to have and I'm saying not just Dallas, in the state of Texas and the United States, we need to have a serious community outreach, especially in high-risk communities, where we're out there daily, beating the bushes and saying to our population that you got to take this serious. You got to protect yourself. I'm out. I volunteer every Thursday in South Dallas. I see a lot of people with no mask on. I'm in Oak Cliff, no mask on. They're not taking it serious. You got African American churches that are going to open up. So we're not taking it to the community. Why set up downtown for testing? Why not set up in the heart of South Dallas? That's because you don't have an African American on the team. Why not set up in Stop 6? That's because you don't have an African American on the team. And so where do we go from here? We got to make sure that as the flu season rolls around, and flu can come early, is that we wear our masks, we protect ourselves. I tell people all the time I have to drive to North Dallas to find Lysol. I got to go to get Lysol wipes. I got to get all of that in North Dallas, and they're not giving us anything to disinfect in our community. So if they don't provide the basics, what makes you think they're concerned about our health? Your health is your wealth.
Yes.
At the end of the day, you can have millions of dollars, but when you land flat on your back in the hospital, that money won't help you.
And you know, you remember the Tuskegee 626 experiment that the federal government conducted by injecting our young men with syphilis and then just allowing them to go back into the community and spread it to see how it was going to work. Do you think that this is some sort of a depopulation thing? You know, they got folks like Bill Gates and others who have preached the planet may be overpopulated, or is that one of those wild conspiracy theories?
Well, I think anything is possible, but the Tuskegee issue was the only time they talked to us when they came down there to give us $10 and a shot.
Good for you.
Now in 2020, I'm not, let me just finish with this.
Yes,
I'm not upset with any population that look out for themselves. I'm concerned that we don't look out for ourselves. I expect them to operate the way they do. The concern is when we allow them. Do you realize that you can't get elected in Dallas County, Tarrant County without the black vote?
That's right.
And you see them in your church and everywhere else for election. They're not come to your community and ask you anything on how to deal with COVID-19. That's the disrespect. That's a total disrespect for you to come out to my vote, but won't even ask me or ask. We got African American doctors, we got nurses, we got professionals who could give input. So I'm not concerned with how they operate, because I expect that.
Yes.
I'm concerned with that we're dying and we don't say nothing. And history is going to show that 2020, that African Americans, similar to when we had a black pastor that told Dr. Martin Luther King, don't come to Dallas. We stood back.
Yes, sir.
The history gonna show in 2020, and that's why I'm saying something today, because I can sleep at night, because Dr. Davis has got me a chance to kind of talk about this, but I can sleep at night. But there's nowhere in the world I could go to bed knowing that no one is saying anything about African Americans don't have a input in the planning, the response, and getting into their community to respond to COVID-19. There's no solution, because there's no vaccine. So that's where we are.
Well, ladies and gentlemen, we've been talking here with Mr. Zachary Thompson, formerly head of the Dallas County Health and Human Services. Very, very detailed information with regards to health.
The Chris Howell Foundation, to me, is another one of those unsung heroes that do a lot in the community to help, even if it's 1, 2, 3, 40, 50 people, to make the world a better place.
Our Healthy Dollars program, and it is our financial literacy program, and we actually want to make sure that people understand how to do a budget, how to manage their credit, how to build banking relationships.
But we wanted to do something different at the Chris Howell Foundation. We didn't want to just give out supplies. We wanted to equip and educate our parents in a way to where maybe next year they're not having to come to get supplies. Maybe they're in a position to actually be able to help someone else get supplies.
I came so that not just for the school supplies, but also for the education that we're getting from financial and the health.
And I'm very happy for these foundations that help people and families, because if you don't have them, then a lot of people are lost. They don't understand. It's good education in it that I just learned something today, and I'm like, okay, pretty good.
All right, now with us right now, we have Dr. Karen Holly, the one and only Dr. Karen Holly is with us here. And once again, we want to thank her for being with us during the Ester Davis Show. Dr. Holly, how are you today?
I'm doing well. How are you?
Pretty good. It's an honor to see you.
Thank you. It's great to see you.
All right.
As always, Dr. Ashley.
All right, Dr. Holly. Well, I'll tell you what, Dr. Holly, I think you wrote a book once called, I think it was called Ask Dr. Holly.
Therapy in a Flash.
Yes, and people
I have two of them, actually.
Okay, and people used to call and ask you about things that are going on, and in light of this coronavirus, we're seeing all kinds of things happen within our community. We've seen a 3-year-old literally beaten to death. We have seen just last week here in Dallas, there was a young woman who, for whatever reason, had a domestic situation with her husband.
Right.
And
Killed
her
herself,
little daughter,
yes.
it was the murder-suicide. The 12-year-old ran outside to be with his father. We have so many people who have all of a sudden just lost their jobs. Life has changed for them.
Life has changed.
And Dr. Holly, as a psychotherapist, a believer, how do we cope with this sudden abrupt change in our everyday life?
Well, we just have to understand that it is a part of our life now, and that it won't always be here. Life changes, and so this is one of those changes that we're going through. And I say that we have to start assessing where we are personally. So we just need to do a personal assessment maybe every 2 or 3 days, see if you're sleeping more than usual, if there's any kind of change, appetite change, less or more, or if you're sad more often or not. So those kind of things. So start doing some assessments and see where you are. And then if you are at a place that you need help, then that's absolutely what you need to do.
Yes.
And we need to get away from what I call the S&S, the shame and the stigma. We've got to get away from that in our communities so that we can get the help that we need. And help is there.
Yeah, because that stigma does exist when you need some psychological counseling or whenever we need to just try to talk to somebody. People say, oh, you're crazy, you can't handle it.
Yes.
So there's nothing wrong with being diagnosed.
Nothing wrong with being diagnosed, and absolutely nothing wrong with receiving treatment.
Yes.
Because that's exactly what we need. And we do it for everything else. If there's a physical ailment, we understand that if we have pneumonia, we need to go in and have treatment. It's the same thing. So if there's a mental illness or any kind of mental condition, we need to do the same thing.
Yes.
And it will work.
Let me ask you about mothers and fathers. Your beloved mother has
Yes.
gone home to be with the Lord.
Yes.
She was a powerful woman.
Absolutely.
And I could tell she was a powerful mother.
Yes, yes.
But in this day and time, when we have mothers who are, the kids are out, school's out, school just abruptly ended, what is your message to mothers and fathers in coping with the children who are asking all kinds of questions and just wondering about their future?
You know, someone needs to give them permission to understand that they don't have to be experts. They are not educators. They don't have to be educators. They just do their part of whatever it is that they need to do now. But most of all, they just need to be embracing their children, celebrating this time, because the time may never come again. So celebrate the time that they have with them. And then I absolutely know that when we look at statistics and we start looking at women, and most especially black women, there's a whole article that Ebony did about the pressure of being a black woman.
Yes.
And so there are a lot of pressures that are associated, and we know that later on we'll see how more and more associated with depression. And it is because they have to fix everything.
My goodness.
And so it's a tough job. And now we're adding on, not only do you have to take the children to school, now you have to teach them. And so that's an added pressure that's on people, mothers and fathers, that they're just not trained for that.
Now also, Dr. Holly, another issue, once again, we're talking here with Dr. Karen Holly, very distinguished author and psychotherapist here in Dallas, Texas, minister of the gospel, the educator, just doing so many things here within this community. Our senior citizens, a lot of nursing homes, where we have come into the point where we have been talking to people who say, well, I can't even go and visit Big Mama. I can't even go up there. And the next thing you know, Big Mama has passed as a result of the coronavirus. Can't even have a funeral. We're not accustomed to this. I mean,
we're going to grieve a different way. We will grieve differently. And so that's very sad. And the same thing I think about when we talk about starting school, and these children would have all of this grief, because by the time school starts, it will hit them that somebody they know may be or may have died. And so that grief is going to come with them to school. And so we have to start talking to them about how grief just has its course. There are 5 stages of grief. And so you just have to go through each one of those stages. They'll go through the anger and the denial and the bargaining, and then they'll go through depression, and then the final stage is acceptance. And so we hope that we get people to that final stage of acceptance. Sometimes they never get there. And then even with the stages, they'll go in and out of them.
Yes.
And so that's normal as well. And so we have to put a new normalcy to what we're doing now.
So we just have to realize that this is something new. We've got to adjust if we're going to go on. Now also, we've been hearing, Dr. Holly, that there possibly could be an increase in suicides.
Absolutely.
How do we deal with that?
Absolutely. Well, the first thing is, if anybody talks about suicide or any kind of increased or giving things away or any kind of signs or symptoms that things may be changing for them, then take that seriously. Get them to a local institution so that they can be evaluated. I carry around with me, especially when I worked in schools, a suicide prevention. It was like a suicide exam. And what it is it's a little quiz to see how likely you are to commit. And so sometimes we want to know and make sure. We absolutely have to take that seriously, because suicide is one of those tricky things that happens. And the way that it manifests itself is that when the person seems the most normal, after you've already seen something that looks like they may want to, then when they become more normal, that's when they are usually ready to complete, because the decision has been made.
Right. And once again, talking over Dr. Karen Holly. And Dr. Holly, also we've been running into some of our pastors who have tested COVID-19 positive.
Yeah.
And now they say people are treating them like lepers. So
yeah,
what do they do about that, Dr. Holly?
Yeah. Well, you know what? The more education that we get, the better we are. And so even with the pastors, we have to do a better job of informing the community. We have the voice. And so with that voice, we need to use it to inform people that that's not what it means.
Yes.
It doesn't necessarily mean a death sentence. And so we have to do some re-education.
Yes. And one last question for you, Dr. Holly, and if there's anything you want to add, but now many people are saying, God, what is going on? why did you allow a pestilence? You know, the Bible warns us about
Right.
pestilence. And many people quote 2 Chronicles 7:14, if my people who are called by my name will humble themselves and turn from their way. What is the spiritual dynamic behind all of this? Is there a spiritual dynamic, or what do you sense is going on in the heavenly realms?
Well, you know, I don't know what the heavenly realms have. Some people do. I just one of them. I'm not one of them. But I do know that I see everything that God does as an opportunity for us to witness. And so this too is an opportunity to witness. And for us to be able to get out and start telling people about God and how great He is and how things will change. And so giving them hope and a future. So Jeremiah 29:11, I guess, would be my scripture for it. Because it absolutely, we do have something that's coming beyond this. But if people don't see it, and if they're not there, then I want them to follow the 4 P's. 4 P's that they need to do. One is they need to begin to pray. They need a pastor. They need a psychotherapist, and they may need a pill. Because medicine and psychotherapy work hand in hand. It's the greatest combination out there. And they will be so much better.
My goodness. Well, Dr. Holly, if people need to get in touch with you, how can people reach you?
They can reach me with Holly Karen at iCloud.com. That's HOLLIEKAREN at iCloud.com.
Amen. Well, what's going
Please reach me.
All right, we've been talking here with Dr. Karen Holly, a very distinguished psychotherapist, an anointed Christian woman here, just a pastor, a great person, just a great person of God. And I tell you what, once again, we want to thank everyone for being with us here on the Ester Davis Show as we continue and get ready to wrap up, if you will.
This is Esther Davis, and I hope you have enjoyed the shows. And we want to hear from you. We want to know what you think, what your thoughts are. So we will be putting all of the information that you want on the screen. And please do me one big favor. Always share the information. But right now, I want to give my personal thanks to Mr. Chris Howell for letting us come down and just invade your space. Beautiful offices. We thank you so much.
Absolutely. Thank you for doing it. And thank you for allowing us to be a part of it. And thank you for watching. And as Esther has already stated, please share the information.
Share the information. And by the way, you really are the greatest audience in the world. We'll see you next time.